Hello, everyone. My name is Cindy Escobar, and today we will be talking about breaking down the stigma in sexual health. I would like for you to picture yourself trying to go for a regular checkup with the doctor. You ask your doctor to test you for HIV and any STIs you have a concern with. Your results come back normal, and you basically do this to be on the safe side for the sake of prevention, because you can never be too safe. You then confide in your best friend about your appointment. You expect a supportive conversation, but instead you get hit with, who have you been with? Did you do something you weren't supposed to do? Did you use protection? Unfortunately, many individuals go through these types of conversations due to the lack of exposure to resources and information. This is what we refer to as stigma. And today we will cover these types of stigmas that as a community we may face and how we should handle these situations. You may be wondering, what is stigma? According to the National Center for Biotechnology Information, stigma refers to the devalued status that society attaches to a condition or attribute. Pretty much the scenario that I begin with, the stigma with sexual health. There are 4 domains to stigma. There is enacted, which refers to acts of discrimination and hostility directed at an individual due to his or her perceived stigmatized status. There is vicarious, which reflects to the perceptions shaped by stories or discrimination against other individuals. There is felt normative, which is subjective awareness of stigma. And lastly, internalized, extent to which an individual accepts stigma to be valid and accept their discredited status as valid. Now, this is just for you to get a better understanding of how stigma works and hopefully helps you discern the type of stigma that you may encounter in a situation. So we may be wondering, how does stigma relate to sexual health? We just tend to correlate a lot of the testings and procedures that we do to being dirty or possibly doing something wrong. Typically, we tend to see this amongst sex workers. If they get tested, they must be either contracted with a disease or they must be carrying some type of infection. Also, with people that are open to different partners, if they are getting tested regularly, they must be mischievous and always doing one-night stands with no protection. This is just something we basically do with a lot of these situations, and we tend to ignore the facts. We should be more aware of how getting tested and seeking more information does not correlate a person to being dirty, used, or in no way infected with the disease. This is just something that we should break down in our community, and hopefully one day we come to the terms that this education should be open and public and not rejected for anyone. So what can be done about stigma in our community? My great advice would be, start with those that are around you. In my case, it would be my family members. There is very little to no information of sexual health that comes from my family. And me being the student in school, I like to pass this information down to my siblings because I just never know whether they are in a situation that they are not familiar with, or if they want to start exploring. It is always better to be safer than sorry. Another thing I would recommend is always connecting with peers or counselors about informative events. I typically think about this and just wish I was back in time, connecting with my high school counselors about taking an event to school and teaching students. I remember in high school, there wasn't a time where a student could talk about contraceptives without getting laughed at. That is just how much of a stigma and taboo we have created that it just makes you laugh. Another way to prevent the stigma in our community would be changing the way we word situations. Instead of asking why or what did you do, start asking when or how can I help? These are ways we can possibly change an individual's perspective and outcomes for their future. Also, referring to the correct terminology based on the disease or sexually transmitted infection. We have seen how people mix up HIV and AIDS when they are totally different from each other. Although they are both very treatable with no cure, we still have a promise of someone living a life with HIV and still be able to live a normal life. I would say if there's one great thing I learned about in my healthy aspects of sexuality class this semester was the awareness and how much the sexual health ambassadors have helped us understand the resources that are available throughout campus. I'd like to think back about the outbreak of 2020, where there was an outbreak of chlamydia on campus, and how this could have been prevented if we had a little bit more awareness or just a push for testing regularly. To say the least, UCO is a pretty diverse campus, and yet we still deal with a lot of stigma for getting tested or just for wanting to reach out for resources. If you are a student that sees this video or that just simply knows where the resource center is for sexual health, I would suggest you take the person there or just show them around campus, introduce them to other students. As a student body, we should always encourage everyone to be healthy. That is the least we could do. Our sexual health is important, whether it's mental, physical, or emotional. We should always seek out for help, regardless of who it is, what the situation looks like, and overall, offer a hand with no judgment. Now to the best part, we will talk about the center. It is located in Thatcher Hall, room 106, and let me just tell you, it is a great place with a great atmosphere with plenty of resources for all UCO students. It is a great place to go sit, relax, and just to wind down a little bit from either stress or just the world in general. There are plenty of great resources for all of my bookworms out there who love to read. There are sexual health ambassadors who are willing to answer all of your questions and concerns. And there are great ways to get free condoms on your way out as well. I am very pleased to say that Jacob Rivas, my health ambassador, has given me more information and educated me about our sexual health center. I am more than pleased to say that this is a great way for students to come in and learn with no judgment whatsoever. We have free resources at UCO for this. There is free HIV testing for all students. It's a great way to be preventative about your sexual health if you are active or if you have multiple partners to protect you and your partners. They have plenty of free resources for its students and free forms of contraceptives again, condoms and just this testing as well. They have a lot of ways of recruiting more individuals. So if you are willing to learn about sexual health and you are passionate about teaching and spreading awareness, the center is always looking for ways to recruit you and many others as well. So how do we spread awareness of these resources? My number one way that never fails would be social media. We are a generation who doesn't leave their phones behind, and we can always take a time out of our day to share or just take a video of the resources that are available and share it with friends, family, or students. It is an inexpensive way to promote the health and resources that can either save someone's life or potentially become a primary resource for somebody that needs to learn about sexual health. Another great way is to either physically or verbally just spread the awareness of the resources. Here on campus, we are always meeting with new students in every class and every semester, and we just never know whether they are needing some resources for them or for someone else. And it is always just best to be friendly, especially now with COVID. We have this thing of not getting too close with someone, but it is always best to just spread that awareness to our classmates. Last but not least, these are my sources. I am thankful for the opportunity to be partnered up with very informative individuals. And I do hope that as students, you're able to learn something and possibly just spread more awareness about our resources here and any resources you know about to any individual who is in help. Once again, thank you for watching and listening.